We all know that the coronavirus affects the respiratory system, but we're hearing from many of you who are still having symptoms 8 or 12 weeks later. So are you struggling for breath when you're at rest, perhaps watching television? Are you feeling short of breath doing simple activities around the home, like doing the washing up or taking a shower? Are you feeling just really tired and really fatigued? These are all things that we're hearing are really common post-COVID or post-suspected COVID. So first of all, please don't worry. The main things for you to think about are you staying hydrated and are you getting enough rest? Is your chest clear of secretions? This is really important, and although we know that coronavirus doesn't typically mean that people will have a productive cough, it will more be a dry cough we're hearing. But this doesn't mean that you can't get a chest infection or a bacterial infection on top of this, particularly if you have an underlying lung condition. The other thing to think about is, how are you breathing? So what does it look like? Sometimes our breathing pattern can change, particularly in response to a period of illness. For example, is it top heavy? So are you using the top part of your chest quite a lot? Breathing at rest should be effortless. We don't normally give it any thought. So it should be in and out through the nose. It should be rhythmical, so all the breaths should be the same size. It should be silent, and it should happen from the lower chest, so the diaphragm. And as we breathe in, the diaphragm will flatten down, and this pushes our lower rib cage out, and consequently it will cause our tummy to rise a little bit. So just have a look at your breathing pattern when you're sat listening to this video and see what it looks like, or what do you think it looks like. Even have a look in the mirror maybe. When you start to feel a bit better, it'll be time to get moving. So can you go out for a walk? Can you walk to the end of your road and back without feeling breathless? We know that it's common to feel breathless following COVID, so just take your time, take plenty of time to rest. Pacing is really important, and split this up into small, manageable chunks throughout the day. Could you do some exercises around the home? For example, sit to stand exercise, going from the sitting position to a standing position. Perhaps repeat this 3 or 5 or 10 times in a row, and again take adequate time to rest. As respiratory physiotherapists, we can help with all of this, as well as direct you to other healthcare professionals should we think that you need another opinion or further examination. So if you're struggling following COVID or suspected COVID, just don't feel back to your normal self, struggling with breathlessness, not quite sure where to begin and want a bit of help, just get in touch. We'll display the contact details at the end of this short video.